Hello, Mr. Vasquez. You're here to have the Athens Protocol operation. Please tell us, why did you choose to have an operation done as a treatment for keratoconus?
The reason why I chose it is because in the United States, they do not use the Athens Protocol. Also, in the United States, it is extremely expensive, and the operation is much longer because what they're trying to do is they're trying to douse the eye with drops and hoping that the riboflavin will go through. But it works for some, but the Athens Protocol is a much more advanced and instantaneous results just about.
So why did you select laser vision in Athens?
The reason why I selected laser vision was because I love to read.
Okay.
So I read as much as I could literally for about a week and a half on this, and Dr. Canelopoulos, his name kept coming up, and the procedure in the Athens Protocol. And we were going to go to, my wife, her mother passed on, and we were going to go to Poland and find out some history of her mother. And then we went to my corneologist, and my corneologist said that my keratoconus was getting worse. And so I said, well, we were thinking perhaps either Poland or Greece. And he says, Greece? If you go to Greece is the best place to go to get this done. So
okay.
He said, so there we go, we're on the plane and here we are. So.
Nice. How was your consultation experience with Dr. Canelopoulos?
Excellent. Excellent.
Did you have all the information?
Outstanding, excellent. Gave me everything in very clear form, and I'm a detail freak. And I know enough about anatomy and physiology, but he explained it to me as an intelligent person who understands it on the same level, and I respected that. That was good. So I understood what I was going into, what was going to happen, what was going to be the procedure, the post results, and I was well aware of what I was getting into.
All right. What pre-operative information did you receive? I mean, you answered that question, but if you want to tell us more.
Oh, the pre-op?
Yeah, the pre-operative information.
Yes, which is basically telling me, yes, this is what's going to happen. It was very clear, and I had some questions anyway. Even though it was clear, I have, what about this? I hate. In math, I always hated the word variable. Okay. There's always variables, so I always ask what are the variables, and I had an answer for all my variables, and that's good because I feel very comfortable doing something that is not normally done, that is not done in the U.S. So it's fantastic.
So how was your experience, and long did the operation actually last?
The experience was remarkably short to me, I thought. I mean,
do you remember?
I really, I think I was in there, I don't know, it seemed like maybe a half an hour or so. And it was some slight discomfort, but it wasn't enough discomfort for me to really, come unglued. I mean, they're working on your eyes. You know you're going to go, so you know your eye's going to hurt.
But did you feel pain?
The only time I felt was towards the very end, because when they did the Athens Protocol on this eye, what happens is he had to, it had to stay open a little longer, which meant as it began to dry, it started ramping up a little, but then he put a drop in and I just laid back and I was like, oh, thank you, that was it. I got the last 4 minutes in and I was I was happy. It was like, man, that was it. You saved my life.
Mm-hmm. So, were you pleased with the results?
Absolutely.
I mean,
Absolutely.
a few days.
No, I mean the next day. I came in the next day with Vasos, was it? And this eye has always been my weak eye. The eye has always been my dominant eye, and has had a stigmatic. But with my weak eye, the tiniest letters I can see, even with the protective lens in my eye. That was amazing. That blew my mind, because I mean, I can't, with this eye, you know, when I was 20, I can see, you know, I can see anything a mile away, but it was fantastic. It was the next day I can actually see the smallest letter in detail. Mind-blowing. Absolutely mind-blowing.
So, what would you tell someone considering Athens Protocol treatment for keratoconus?
Run. Do not walk. Run, sail, fly, take a rocket. I don't care how you get here. Get here and get it done, because this is not done in the U.S. It is not done in the U.S. because of the FDA. And it's a very sad thing, because it's not much different, but different than other procedures that are done normally. Why they deny this, I don't know, but you're going to have to come and you're going to have to pay for it, but it's your eyes. You have to live with your eyes, so spend them. If you buy a car, you buy clothes, you buy whatever, spend it on your eyes. I'm very happy right now, and I know it's only going to get, for the doctor to tell me that it's only going to get better than what it is now, I'm thrilled. I'm thrilled. I mean, one of my hobbies is long-range shooting. I spend a lot of time behind a scope, and when you're behind a scope, you have it's a lot of strain on your eye, and you have to look and you have to avert, look, avert, look, avert. So I'm just thinking how much better I'm gonna be at this. Oh, I'm just gonna smoke my friends out. My friends are gonna be so mad that I went here, because they won't be able to outshoot me, which is good. And I just shoot paper. I don't no animals or anything. I just like to make little holes in paper. But I'm really pleased that. And I love to read. I have a library at home, and you can ask my wife. If I am not doing something in the house, I am reading constantly. I have the more I read, the more I found out how stupid I really am.
Your vision is very precious for you.
It's absolutely precious. Vision is precious to everyone. Vision is a blessing that we can see. When you see a blind person, they have other skills, but the blessing to be able to see this beautiful water, the land, the features that are here, the history that is in Greece, to me is a blessing. And I was actually able to see it and enjoy it, even with the surgery. And that's just fantastic. And I would say anybody, if you have keratoconus, you have to come here, because they only will treat you through osmosis with B3. This way, he actually removes and the epithelium, puts it in, and I guarantee you, the next day you will see things that you never saw before and be extremely satisfied.
Thank you very much.
And that's from my heart. And I love all you guys. The crew here is the best. Everybody here is the best. You're the bomb. Vasos, Irina, they're all wonderful people. Extremely intelligent, extremely caring, courteous, and very compassionate, and very patient. When you come here, do what they tell you to do, be patient, and you'll get your results. Don't come here being a crybaby, it's gonna be what it's gonna be. You might have some discomfort, fine, but you're gonna walk out the door and you're gonna be able to see things that you never saw before, and you're really gonna be happy. So fly, take a boat, I don't care how you get here and get here fast if you have it, because it's eventually you'll lose it, and you don't want to be in that position.
Thank you very much.
My pleasure, my pleasure. I love it here. Great
Nice
people.
seeing you.
Get over here fast.